All right, to all who are new here, my name is Dr. Michelle Henney, and I'm currently on maternity leave. And I'd like to welcome you to Releve Sports Medicine's Virtual Journal Club. For additional webinar educational opportunities, you can visit our website and register directly for the webinar or sign up for the email list to be notified of upcoming webinars. We are continuing to update our schedule, so check back often. This video will be available for review after this journal club. The information contained in the video content represents the views and opinions of the presenters and does not necessarily represent the views or opinions of Releve Sports Medicine. The mere appearance of video content on the website does not constitute an endorsement by RSM or its affiliates of such video content. The video content has been made available for informational and educational purposes only. The video content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen on the site. RSM hereby disclaims any and all liability to any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly from any use of the video content which is provided as is and without warranties. We are looking for for all athletic trainers who are intending to get live CEUs from the VOC. You will receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz evaluation and assessment. You'll have up to 72 hours to complete the quiz and the evaluation. This email will come from customercare@gotowebinar.com. Please ensure that this is done to receive your statement of credit. If you don't receive the follow-up email or you have any other concerns, then contact us via our email at journalclub@relevesportsmedicine.com. Once the statement of credit is available for download from our website, you will receive an email notification. If you have any questions during the webinar, please submit the question and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slide and you're accessing the webinar from your mobile phone, swipe the screen to the left or to the right and the slides will become visible. The recording will be available for review from our website tomorrow. Our speaker this evening is Dr. James Mick Lynch, who is a sports medicine physician and author of the U.S. Soccer Sports Medicine book and the International Olympic Committee Handbook series on soccer. He is also a past speaker at the U.S. Soccer Symposium on the Sports Medicine of Soccer. He is also an honorary lifetime member of the NATA. He completed his medical school at the University of Missouri, Columbia, residency at the University of Kentucky, and fellowship at Andrews Sports Medicine Institute in Birmingham, Alabama. He currently works as faculty at Southern Illinois University School of Medicine. He's presenting today on Trust as Cement, Communication Skills for Daily and Crisis Information Flow. And I'll make you the presenter. And did you get a little button? Yep, perfect.
Yeah. Okay, so you guys can see that all right?
We can see it. It is in presenter mode.
Double mode. All right, let me see if I can figure that out.
Yeah, sometimes it has to do with which screen is being shared.
Okay, let me try this. So does that fix it? No, huh? All right, so how's that?
Yes.
Okay. All right, so thanks for letting me join you guys. Now, so, we're going to talk about the soft skills. So how do you talk to your patients, athletes, clients, however you want to term them. So this will be communication skills for just your daily old stuff. And then a little bit on when you have those big injuries that are season-ending, career-ending sorts of things. So, these are the basic objectives that we'll go through so that administrative people, the education accreditation are happy with how we're going to work this stuff. So we have some actual goals that we're trying to accomplish. And I don't have any conflicts of interest with this, so that we're happy, everybody's happy with. Now, so here's my first slide. And so if you're doing medical communication, you can see on most of these slides, the article that I'm referencing is down here at the bottom. So this is one that made a big hit about 3 months ago. And so what they're doing is breaking this out into sections. And so the message, you guys are pretty good at it. Okay, so we won't really spend a whole lot of time in this box because you guys go to these webinars and you have a lot of information that you already know. So accurate and authentic, transparent about uncertainty, that's an important one. So if it's not clear, so when you read a lot of the review articles, they'll often say there's not enough data to really decide this. So it's perfectly appropriate to say that to the patient and say, this is what is considered most appropriate, our evidence-based stuff, but there's some question in the literature. So if this doesn't work, we're going to move on to the next thing. And so that'll be relatable to your audience, and you'll have your actionable solutions. So this stuff, I think, is fairly straightforward. Now, the messenger part with this is they're kind of going with, it doesn't always have to be you that is the expert. So you can bring in other people, have a good relationship with your coach, encourage the coach can encourage the injured person, the athlete, that sort of thing. So the religious leaders and the social influencers within this particular article, they were also approaching some, kind of national sorts of things with COVID vaccines and that sort of stuff. So that's where they're coming in here. And then the social context is, where's your patient coming from? Where's your athlete coming from? For us, this is a little bit, the easy example is what part of the season are you in? If you're near playoffs, you're going to be a little more likely to take a risk than if you're early in the season. So that's a lot what this social context is all about. And then down when they're talking about the strategies, which is, really kind of what we're discussing tonight, the narratives, okay, was somebody 4 years ago in this same boat? How did it happen to them? How did, some major leaguer do things? How do you recover? That sort of, so can you tell a story? The empathy messaging will come back to later in a slide down the way, so I won't do a lot of that, but convince them that you care. And athletic trainers and physical therapists, the rehab professionals, are generally really pretty good at that. Okay, then we've got the psychological inoculation. And this again we'll come back to, but the notion here is that there's a lot of misinformation. So-and-so does it this way, they do it this, lots of, and you'll get family members who say, I'm not sure I do it that way. Well, the psychological inoculation implies that I'm going to start establishing right away before the rumors and misinformation can get involved that this is how it's done, this is the evidence, this is where I'm coming from, this position statement says that, show them where the evidence comes from so that if they get told some other information, it's not so likely to catch. And we'll come back to that. Then the social norming in our situation would be the average ankle sprain takes. The usual cough is there for 20 days, that sort of thing. So what's normal? We're shooting for faster than that, but it doesn't always work out that way. And then a harm reduction is, in our instance, giving them a plan. Okay, so this is how we're going to approach things. I look at it, the easy example is You hurt your shoulder? Okay. The next few weeks we're working on shoulder rehab, but we're also going to get you really strong legs and a really strong core. So we're going to do things to make you a better athlete while we're approaching your injury. So with these sorts of things, you can lay out an agenda and start addressing some of their concerns that they maybe haven't quite told you yet. So these soft skills, in the medical paradigm, they're broken up into content and process. So this content stuff here is, really typical. I teach the medical students the first week about this sort of thing, and then we launch into the details. So you all have heard the same thing, chief complaint, I hurt my ankle, when did you do it, how have you done it before, et cetera, et cetera, et cetera. So that's fairly basic stuff. You're getting the info you need to make the diagnosis and then decide what the appropriate rehabilitation approach is going to be and how long is it going to take in your estimate. So that content stuff is pretty straightforward for y'all. That's nothing new. Now the process is essentially, how do you convince them that you care and you're nice and you're going to take good care of them while you're poking around on it? Because, realistically, we say, where's it hurt? You poke on it to make sure it hurts. Then you go around and do your exam, and then you poke it on again. So how do I convince my patient that I care when I keep poking them on the place that they hurt? So that's where we're kind of coming from with process stuff. Now, this is a slide, and down here at the reference, this is the Calgary-Cambridge structure, the framework. And so this lady here, the Kurtz lady, the lead author here, she was involved with the original Calgary-Cambridge guides. And lots of the various health professions, medical schools in particular, use these guides to help typically third year students, second year students, third year medical students to kind of orient themselves. And if I'm grading somebody on how well they're interacting with the patient, I'll make sure they hit all these things. Okay, so this is the basic framework. Come in, you say hi, what happened, you gather the information, your content things, do your physical exam, and then you set the agenda, and then you close the session. Now, with kind of how I'm looking at this session here tonight, is I'm really targeting more the athletic trainers and physical therapists that are in clinics or are contracts where they're only in the high school 1 or 2 days a week. If I'm there every day, it's pretty easy. I know the athletes well, and I know where they're coming from. But if you're in this a little more isolated position where they're coming to you and they're not coming every day, it gets sizably harder to establish that trust relationship. So that's really where we're driving at. So there was, historically, there's this content, and that's been in place for a long, long time. Get the history, get the past medical history, social history, family history, medications and allergies, usual stuff. So here, the Calgary-Cambridge people started saying, that's not quite enough. How do you establish rapport? And so they broke it out into the structure. I get my information, and then you also work on the relationship. And so there's techniques you can do. Now, this particular article, this Dr. Kurtz has expanded from the original guides. And so here's what they've added in. So in particular, they care about this patient's perspective. So that's really the newer part to this well-established Calgary-Cambridge guides. So you still initiate the session. Hi, how are you? That's usual stuff. You guys all do that. You gather your information, but instead of just getting what happened in the injury, you're kind of working on how nervous this is you make. big of a disaster do you think this is? How resilient are you? Is this your first injury? Or have you been through this process before and you're convinced that it's going to go well? You're not going to lose your starting spot forever, that sort of thing. And then you work through and you do these other things. So this providing the correct amount and type of information is not using a lot of jargon. We'll come back to that a little bit later. You're aiding accurate recall. That's just doing a recap. So you talk back to them. What did they just tell you? Okay. Did you understand the way they meant? And that's going to be a two-way street. So we're going to come back to that as well. And then shared decision making. Okay. So that's become a really big deal within the medical world. We've moved far away from the paternalistic attitude that I know what's best and this is the way we're going to do it. So you want to couch it in, okay, where are you coming from? The simple one is we early in the season, we late in the season. If you're senior and you're late in the season, you plan on going to college and continuing to play, do we make sure you don't go into college with a big injury, et cetera, et cetera. So that's what they're talking about with decision making. Then closing the session is particularly important if you're in the clinic or only get to see you once a week sort of stuff. So there you need to make sure that they understand what they need to do until the next time that you see them. Okay, so this part has been expanded. So all this will come back. Involving the patient is really kind of the big deal here. Okay, and oops. And then here's this slide will give you, it's out of the same article. Okay, and this will give you a little bit more detail with this. So patient's narrative, you got to actually listen. Okay, so physician-wise, physicians are famous for interrupting a lot. And so you want to let them tell the story. It doesn't actually take that long for you to sit and be quiet that the patients are really convinced that you actually listened. So a little bit of quiet will do good. Open questions versus closed, we're not going to mess with that. Attentive listening is being quiet and letting them tell a story. We'll come back to that because sometimes that's problematic if you've got yourself a real talker and you need to stay on time. Clarification, time framing is going to be a big deal with, okay, this is what I think how long it's going to take. 2 weeks, another couple of days, that sort of thing. Now, in our world, there's enough of a variety in the healing process. And when you're in season, you're on a deadline. I want to be ready for the next match. Rather than time framing, task framing is probably the better way to go. When you can do this, we'll move on to the next step so that you're not really just saying everybody heals the same way. And on day 13, you're limited, and on day 14, you can go full go. It's can we do more progression? Then down here with the patient's perspective, this is really the thing that's newer within. And so where are they coming from? Okay. And in the background information is usual stuff that goes still with the content. Okay. So here's kind of the updated Calgary Cambridge framework. Now this next slide is off of a really new article. And this one was interesting and pretty good. So if you're kind of lukewarm on how important this social skills stuff is, this is a good one to read. Now, it's a review. Okay, so the first half of the article is kind of boring. Okay, so it's the usual systematic review thing. So the first half of the articles are saying we picked out these keywords, we did searches in these databases, we got 14,000 bazillion articles, and we trimmed them down to 47. Now once they get through all of that part, this article becomes pretty interesting. So kind of the results and the discussion in this article is useful to read. And so what they're doing is you got your therapeutic consultation, individual exercise, okay? So what am I going to do with you to make sure you get better? And then how do you talk them off the ledge? How do you make sure that they understand and are convinced that you really care? So we have all these various things. And within this article, they do a really nice job of saying that, these things made a difference. This didn't help very much. These things did. Okay, and so these are the ones that they thought were quite useful within the various questions they asked when they were reviewing all these various articles. So this one is worth looking at, okay? And so there's education and reassurance. So that's talking to them every time you see them. In the traditional rehabilitation setting where you get to see them, academic setting, I should say, where you get to see them every day, this is fairly easy to do. It's tougher to do when you're limited to 3 times a week, once a week, that sort of thing, because they have time away from you when they can kind of have that little voice talking in their head. Oh, what did they say? Am I doing it right? Et cetera, et cetera. Supervision is really helpful. It's really tough to do in the non-academic setting. Peer support is really important. And that's kind of sometimes tough with the disinformation. So we're going to come back to that one. So we've got, these things, and this is just another way of looking at the various ways you can approach this. This particular article, it's recent and I liked it. Okay. Now, kind of nuts and bolts, what are the things you can do? So what are the things that we hear at SIU talk to the medical students about right away? And this applies to health professionals. Use the patient's name. In the traditional academic setting, that's fairly easy to do because you see them all the time. In the clinic sort of scenario where you're not getting to see them all the time, that gets a little harder to do. But you've got the chart, so you can look and remind yourself who they are. But convince them you know who they are, and reintroduce them, reintroduce yourself. And the reason for that is, how good are people with names? So it takes a while to get somebody. And so in the clinic setting, we're not getting to see them all the time. There's all these people walking around all the time, distracting you. People are liable to forget your name. So make sure that every time you come through, you remind them. And eventually it's going to get obvious that they do remember your name, but make it easy for them because people forget often. And if you're particularly in the clinic setting where there's lots of people that are helping, physical therapy age or athletic training students, graduate students, et cetera, use their names. Remind them that. And sometimes it might be okay, the primary care doc did this, the orthopedic surgeon suggested that, you're going to go see Dr. So-and-so, the orthopedic surgeon, in a week, whatever. Make sure you use names so that they're convinced that there's a bunch of people looking out to help them. Right? Then other really simple thing is sit. And really, it's don't move. Okay, so within this therapeutic world, you want to be roughly the same eye level. Okay, so that you're not standing up and moving over them. Okay, in the hospital setting, that's a large big deal because they're in the bed and you're standing up, and there's that paternalistic dominance that's in there. So if you can manage, get it eye level with them when you're talking. That's particularly important when you're having tough conversations. You're going to miss the next game, etc. Stuff like that. Then, particularly in clinic and for sure with physicians, because physicians are late in clinic a lot. Address it. Say, I'm sorry I'm behind. And most of the time you're behind for a reason. Somebody had an unexpected problem and you had to take longer with your patient than not. So In this particular article, they make the suggestion that you just say, hey, I'm really sorry I'm late. Somebody 3 patients ahead of me really had a big problem, and I needed to take the time to address it. So I'm sorry I had to do that, but if you are in here someday and have the same sort of bigger problem, I'm going to take the time with you as well. And kind of sort of get them to forgive you a little bit for always being late. Okay. Now that's less of an issue in the academic setting where you don't really have time things, but acknowledging that their time is important as well is kind of what you're driving at here. And then as we continue to go through this being a good doctor article that made a fairly big hit about 4 or 5 months ago, smile. So, be pleasant, listen. That's a really big deal. Take the time and don't interrupt for a little while. And then toward the end in there someplace, affirm their experience. That must have been hard. That really stinks that you're missing practice, et cetera, et cetera. So acknowledge that you understand this is upsetting. It's likely to be really run of the mill for you because how many bad sprained ankles have you taken care of, or rotator cuffs, et cetera, et cetera. You guys do this all the time. One of the things with past medical history is figuring out, is this the first time this happened to them? That is a distressing situation for most people. So being able to say, yeah, I understand this is perceived a problem for you, okay, that will help them. Okay. And then the next thing, make sure the family understands, because the family's talking to them often. So while you're not there, they're not in a cocoon and being totally by themselves. So make sure the family understands, make sure what you said is what the family understands so that everybody's on the same page. And how do you end this? Okay, so how do you get through and make sure they leave satisfied? And if they're hurt, they're likely not to be leaving happy if they're hurt. But how do they leave satisfied that, yes, you paid attention, you have a good plan, and you care? Okay, so kind of, it's what else, right? So, okay, we talked about this stuff. What else is going on? So, I learned, do you have any questions? Okay, but the current paradigm is that's not very nice sounding. I don't know. I am okay with, do you have any questions? But in the literature these days, they're changing the phrasing around a little bit. Okay, so what questions can I answer for you? What questions do you have? Okay, I'm sure you have questions. Please ask me so that I can answer them for you. Okay, and so the notion here is, do you have any questions, is sort of, hey, I got things to do. I'd really rather you didn't ask questions. So tone matters with this approach, okay? But if you're in a clinic setting and you're running late, you can't give them a ton of time to bring up 4 other problems. It's just not realistic that you're going to be able to take care of the rest of your patients. So in that scenario, this bottom article here, the bottom citation, here they talk about what questions do you have about what we talked about today. So if you're in a rush, you're behind, okay, you got 14,000 other people you need to see today. You got a really tight schedule. Limit it to what did we talk about today, so that you don't get pulled off in a lot of different directions. But if you're having a good day, what questions can I answer for you will really convince the patient that you care, okay, and that you're gonna do what you can to help them out. Okay, so be approachable. The second one here, is really much more for physicians. Okay. But a few of the, the physical therapy clinics are starting to move them toward, like a lot of physical therapy clinics are starting to move toward electronic medical records, that sort of thing. So make some eye contact. Okay, you can't just look at the computer. If you can get away with it, letting them look over your shoulder at the computer is pretty useful, because then they see that you're actually accomplishing a task when you're typing away on the keyboard, and they can help you with, that's, it was 2 months instead of 3 months, and that sort of thing. Okay, so if you can manage, that's a pretty reasonable thing to do. And then my personal, thing that I really want people to do is follow up on promises. Okay, if you say that you're gonna send them an article, find an appliance that they can order online, that sort of thing, follow up. If you follow up on promises, you are gonna be a best friend for forever. So that's really a biggie there. Okay, and again, that's off of that same fairly short article here. And remember that talking to you is really an excellent therapy. Okay, so when you have the time and can manage to, talking them through, answering questions, really increases their confidence that they can in fact get better. So really important. You as a health professional are a really important tool. So just right there, talking to you and convincing them that you're there for them will greatly help their motivation and their attitude toward getting better. Okay. Then, here. All right, so this will come back to that very first slide. We talked about psychological inoculation. Okay, so here, this is disinformation, is kind of the underlying paradigm here. Okay, so in our world, it often happens that, well, my cousin Billy Joe had this, and they did it this way. And so why aren't they doing it this way? Are you getting good care? So there's lots of ways to approach this. So how do you establish information literacy, essentially? So I think this is pretty useful in the high school setting. In the commercial setting where you're dealing with a lot of adults, that sort of thing, I'm not so sure this will be terribly useful, but I was intrigued enough by this from this article that made a pretty big hit about 4 months ago. And so this bad news website, and I have the website in the blue under here, it's a computer game, it's an internet game. So it goes through and it gives you, information, and it helps you sort out, is this reliable information or is this misinformation? And so it's Oxford has done this, and it's made a big hit in the academic world. So this is pretty useful if you want to sort of set the tone with your clients. And I think this would be limited to your athletes, particularly high school athletes. This is a way to get them to be more discerning about what information they're listening to. And then here's another method that's been around for a pretty long time, and I've not seen it referenced in any of the athletic training and physical therapy literature that I've run across. So I thought that I would toss this one out here too. And some of it is, it's fairly simple mnemonic, so that you can keep track of what you've been doing. So you're seeing somebody in follow-up, it's been a week since you got to see them because of insurance requirements, that sort of thing. It's okay, what's been going on? How you doing? Etc. How's it affecting you? And here it's kind of, have you been doing your homework? Have you been doing what you're supposed to get better? Then what troubles you most about your situation is, okay, I haven't managed to do my exercises every day like you wanted me to. Well, why not? Okay, so you start asking those questions. What's happening? How are you handling it? My fourth one there. Okay, now they're starting to figure out that, okay, I care about you and your situation, and you start problem solving. Okay, and so I couldn't do it because we're in the middle of finals, that sort of thing. And so start, you can empathize. Oh, that's hard. Yeah, I can see how that happens. I wish that wouldn't happen to you, but what can we do? How can we adjust? Do I need to change this stuff around? And so you work through. So this is another really good method for working your way through and solving problems, negotiating essentially. How do you manage to get them to do what they need to do so that they can get better and get back to their preferred activity? Okay, so I really like this one. It's really designed. The original articles that came out with this were counseling and psychotherapy, but this is useful in just about any patient situation. Okay, so I like this one a lot too. Okay, and then here we've got the difficult encounter stuff. Okay, so what do you do with, in my world is, what do you do with the angry patient? I just gave them really bad news, you've got cancer, et cetera, and they take it poorly. That sort of thing. Now, in the sports world, that doesn't happen nearly as much as in the straight medical world. So my notion of a difficult clinical encounter sports wise is much more often they don't quite follow the plan. Okay? And so my favorite difficult clinical encounter story is from way back in the 70s, 80s. There was an orthopedic surgeon in Iowa who had been an Iowa wrestler. And so he was doing a review article on wrestling injuries, because at the time there weren't all that many really good ones that looked at the gamut. So he, talked to University of Iowa because he was an alum. He got several schools to let him look through their injury records and compile it, and he did a nice statistical review. And then he had a narrative, so he told some stories, and he, talked about the range, and his example of going overboard being the difficult patient this was back in the days when they still did long leg casts for a lot of things. And so this particular wrestler that he was talking about was in a long leg cast for an MCL. So this wrestler sneaks out of the hospital, goes on a 5-mile run in his long leg cast because he knew he wasn't going to get to work out that day, and he was worried about gaining weight. Okay, so that's a little bit more of the difficult encounters that I foresee with sports medicine wise. And so what do you do about that? So, that one, I've put into the situational issue. This guy needs to make weight. He needs to stay there so that when he returns, he can get back into the meets right away. So how are you going to approach that? What are you going to do to solve that issue for this guy? Okay. And, the physician characteristics is, how tired are you? Could be the athletic trainer characteristics as well. So, this is rehabilitation professional characteristics. How tired are you? Okay. You had a rough day, those sorts of things. So you work through that. But, realistically, the difficult encounter in sports medicine is not quite the difficult encounter in the general medical scenario. Okay, so this is something to consider, but the literature here doesn't always apply to the sports medicine stuff. Okay. And then we have, I just had a bad injury. So here, if you look at this reference here, it's communicating about serious illness and end of life. So, we're generally not that dramatic that I need to be talking about end of life things with athletes. But in the high school and college setting, if you tell somebody that their career is over with, you got to get, or their season is over with. Okay, you got to get surgery for that ACL, et cetera, et cetera. To that group, that's pretty close to being a dire diagnosis, me getting cancer. So I think that you can use roughly the same sort of paradigm for this. So part of this is, and what I think within athletics this fits the best is, oh no, I can make it back. What do you mean I don't need surgery, et cetera, et cetera. So this extreme hopefulness, that's the way it is. So, when I'm sure that you guys are all familiar with Kubler-Ross's death and dying, the 5 stages of grief sort of thing. Well, this is just like that. And so that takes a while. And so within the field, when they're talking about that, they talk about prognostic awareness, okay? What is likely to happen? So yes, you tore your ACL. That means you're going to need, it's likely to take this long, okay? And you're going to have to repeat that again and again and again. So your athlete's kind of supposed to have this extreme hopefulness, okay, for a while. And then they will start to become more realistic. So your job is going to be to say it again and again and again. Almost surely this won't happen in one conversation. So you're going to need to be patient and go through it again. And when their friends, family talk to them and what if and could you, that sort of thing, then you're going to have to do it again. So this part, these season-ending, career-ending injuries need a lot of talking, okay? And you're going to repeat yourself often. So you got to listen, respond, listen, respond, okay? Plan an agenda. So typically this is going to be season-ending rather than career-ending. So lay out the plan. When are we going to get you back? When do you need to get back to be in enough shape to be successful the next season? Are you going to get your starting spot back your senior year if you're at your junior year? That sort of thing. And you got to partner with them. Their attitude is going to go up, go down. That is really distressing if my season ends. Okay, so you got to be patient and work your way through. Okay, so in that article, they have this graph, okay, and you'll see this cycle here. And so you talk again, they come back with questions, and this is a long drawn out process. And so you're shooting for adaptive coping here, and then you've got your resiliency is built by prognostic awareness. Okay, this is the plan. I understand. We're going to go through. Okay, and so this particular article is end of life, all right, but this is end of season. What are we going to do to get you back for next season? So I need a lot of time. This is going to be several long conversations that you'll almost surely have to do. Okay, and so here we've got another graph out of this same article about serious illness. Okay, so when they come back, okay, so do they understand the plan? Do they remember what you were driving in? What's your understanding? Okay, so what comes next? What are our tasks? What things do I need you to be able to do? Okay, what are the parameters? I need to get rid of the swelling in your knee if you had an ACL so that we can proceed with those sorts of things. Respond to the questions, respond to the emotions. So empathy, okay, yes, this is really, really sad, and I really wish it wouldn't happen to you, et cetera, to, yeah, this sucks, okay. Talk to the loved ones, coaches, and if you're in the academic setting, that sort of thing. And then what matters to you, okay? So is this my senior year and I really want to play in the, for senior day? Is this my senior year and I've got a college scholarship and I want to do really well in college? Those are different scenarios that you need to approach. Okay, and then depending on what they care about, you need to start addressing it. So these are big conversations that have to go again and again and again. Okay, and so here, kind of, in summary, and so the deep work of doctoring. Okay, so I would maintain the deep work of healthcare because I don't think there's a whole lot of difference between how athletic trainers, physical therapists, and physicians should be approaching patient care. All right. So I think this fits with everybody. So trust both directions. So, you're always asking me to trust you, do what I'm asking you to do. I know the right thing, but you have to have trust there as well. Right. So if they don't accomplish the task that you set for, this last week when you didn't manage, couldn't see them because of insurance, well, they didn't do it. I trust that you tried. What happened? Okay. So make sure that you establish quickly and well that, yeah, I trust you to tell me, etc. So both directions, undivided attention. So listen, right? You have to have time to listen. So, I was taught as an intern, somebody told me that you can't rush from patient to patient. You can rush from room to room, but you can't rush from patient to patient. So it took me a while before I really understood what that meant. But undivided attention. Now, as a side note with that, if we're talking about mindfulness and meditation, taking care of yourself, okay, provider well-being, okay, undivided attention is a part of that. Okay, so these will work. And there was an article that just came out last night talking about the joy of work. Okay, and it just came out last night, so I already had my slides set, so I couldn't add it in. If anybody cares, email me, and I'm happy to send it off to you if that's the sort of thing you like to read. But it's working through and accomplishing tasks. And this last one here, this problem solving, this notion comes out of the business world. And so in the business world, they talk about solution shop work and production line work. Okay, and what we want to do as healthcare professionals is the solution shop work. So this is making the diagnosis, figuring out what to do about it, establishing a therapeutic plan, getting all your interventions worked out. The production line work is filling out all the paperwork. Okay, so what insurance forms do I have to fill out? How do I get everything entered into the electronic medical record? All that sort of thing. So you want to do as much as you can to concentrate on the solution shop work, and that's going to give you a lot more job satisfaction. Okay, so that's really kind of within the medical world these days. There's a lot of talk about that with, corporatization of medical interventions and that sort of thing. So the notion is I want to have my professionals doing solution shop work. How do you solve the problems of the patient, the athlete that's right in front of you? So you can do this quadruple aim that's down at the bottom here. Fulfilling work and lower cost. Okay. Athletic trainer, rehab professionals can save people a lot of money and a lot of hassle. So rehabilitation professionals do really good at that sort of thing. So how can we keep the costs low and be really happy when we finish our day of work? Okay, so, all right, so go back to here's the learning objectives. If we're having a session on communication, I figure I maybe ought to communicate. So feel free to have any questions. I'm happy to talk back and forth. I like the banter a lot more than I like yakking at you guys.
All right, so I am gonna wait for some questions to pop up here. I will say I was very impressed. Many of those articles were published in 2024, so they must have been within the last couple of weeks then. Very comprehensive talk then. Yeah, certainly an excellent lecture and very relevant in terms of what we're all having to deal with on a daily basis, regardless of which athlete you're working with. So thank you very much for a fantastic presentation. I know it was specifically requested amongst many of our attendees who many of them know you. You know, normally we to have you come on back and give us another talk. And as always, thank you very much, Mick. It's another excellent talk. Maria Kofer said thank you, Dr. Lynch.
Hey back, Maria. Hope you're having fun.
Okay, and Meg said, thank you for sharing. This was a new topic for me to hear about. I sometimes have a hard time relating to middle school athletes, and you've provided some good information that will help.
Oh, working middle school is hard. You're tougher than I am. I mean, that's one of the really good things about doing college sort of stuff is if the college athletes are being stupid, you can tell them so. And you know, middle school and high school, you can't quite be that blunt. Middle school is tough.
Okay. Well, thank you. Like I said, thank you for an excellent presentation. It always a good one for sure. And thank you to everyone for attending tonight. All right. Have a good one.
The
Bye.